Woman destroyed her kidneys by taking these common vitamins. In December 2022, a 55-year-old woman with kidney disease arrived at the emergency room in a concerning state. She was lethargic, her heart rate was abnormally slow, she was visibly swollen, and her body temperature had dropped to a chilly 93 degrees Fahrenheit. Her creatinine levels were tested immediately because of concerns about her worsening kidney condition. The results were alarming. Her serum creatinine level was 3,530 milligrams per deciliter, a dramatic increase from just 2 months earlier. Her kidneys had stopped functioning properly, and she wasn't producing urine. Overloaded with toxins, she was moved to the intensive care unit and started on dialysis the same day. But what had caused her kidney function to decline so rapidly? After thorough investigations, doctors discovered that her rapid kidney deterioration was due to a seemingly harmless vitamin that many people take daily. As a healthcare professional with over a decade of experience working with kidney disease patients, I feel it's essential to warn you about the hidden dangers lurking in your bathroom cabinet, not from prescription drugs, but from vitamin supplements. There are 5 vitamins that can be particularly dangerous if taken incorrectly, especially for individuals with kidney disease. While neglecting to take necessary vitamins can be harmful, it's crucial to be cautious about the supplements you do take. The case I mentioned is just one of many instances of hospitalizations caused by incorrect vitamin supplementation. Let's explore 5 vitamins that can be risky for kidney disease patients, starting with the least dangerous and moving toward the most harmful. 5. Vitamin D, balancing benefits and risks. Vitamin D, often referred to as the sunshine vitamin, is crucial for maintaining bone health and supporting immune function. It plays an essential role in calcium absorption, which is necessary for building and maintaining strong bones. However, vitamin D's fat-soluble nature means it can accumulate in the body's fatty tissues and liver if consumed in excess, potentially leading to toxicity. High levels of vitamin D can cause hypercalcemia, characterized by elevated calcium levels in the blood. Symptoms of hypercalcemia include nausea, vomiting, weakness, and serious complications such as kidney stones and kidney damage. Hyperphosphatemia, or elevated phosphate levels, can also occur, compounding the risk to kidney health. Scientific studies suggest that a daily intake of around 2,000 IU of vitamin D is generally safe for most individuals and effective in preventing deficiencies. This dosage supports optimal calcium absorption and bone health without significantly increasing the risk of toxicity. However, individuals with certain health conditions or those taking other medications should consult with healthcare professionals to determine the appropriate dosage. Combining vitamin D with vitamin K2 and magnesium can further enhance its benefits while reducing the risk of complications. Vitamin K2 plays a vital role in directing calcium to the bones and teeth, preventing its accumulation in soft tissues and arteries. This synergy helps maintain cardiovascular health and reduces the likelihood of arterial calcification. Magnesium is another critical nutrient that works in concert with vitamin D. It helps convert vitamin D into its active form, ensuring it can effectively regulate calcium levels. Additionally, magnesium helps balance calcium within the body, preventing the potential negative effects of hypercalcemia. Foods rich in magnesium, such as leafy greens, nuts, seeds, and whole grains, can support this balance. In summary, vitamin D is indispensable for bone health and immune function, but its fat-soluble nature requires careful management to avoid toxicity. A daily intake of around 2,000 IU is generally safe and effective for most people. Combining vitamin D with vitamin K2 and magnesium can optimize its benefits and mitigate risks, ensuring a balanced and healthful approach to supplementation. 4. Vitamin B12, choosing the right form. Vitamin B12, an essential nutrient, plays a pivotal role in maintaining nerve function, producing DNA, and forming red blood cells. Deficiency in this vitamin can lead to severe health issues, including anemia, neurological disorders, and cognitive impairments. Therefore, ensuring adequate intake of B12 is critical for overall health and well-being. The synthetic form of vitamin B12, known as cyanocobalamin, is commonly found in many supplements and fortified foods. While cyanocobalamin is effective in addressing B12 deficiencies, it contains trace amounts of cyanide. Though the cyanide levels are generally considered safe for most individuals, they can pose risks for people with reduced kidney function. The kidneys are responsible for filtering out toxins, and impaired kidney function can hinder this process, potentially leading to cyanide accumulation and toxicity. For individuals with kidney issues, methylcobalamin, a natural and safer form of B12, is recommended. Methylcobalamin is one of the two active coenzyme forms of vitamin B12 and is more bioavailable, meaning it is more readily absorbed and utilized by the body. This form does not contain cyanide and therefore does not carry the same risks as cyanocobalamin. Scientific studies have shown that methylcobalamin is not only more efficiently absorbed but also more effective in improving neurological health. It supports the maintenance and regeneration of nerve cells and enhances cognitive functions. For individuals with compromised kidney function or those seeking to avoid synthetic additives, methylcobalamin represents a superior choice for supplementation. To provide context, the recommended daily intake of vitamin B12 for adults is approximately 2.4 micrograms. This requirement can typically be met through a balanced diet that includes animal products such as meat, fish, dairy, and eggs. However, vegetarians, vegans, and those with absorption issues may need to rely on supplements to achieve adequate levels. In summary, while cyanocobalamin is a common and effective form of vitamin B12, individuals with kidney issues or those seeking a more natural option should consider methylcobalamin. This form offers higher bioavailability and eliminates the risks associated with cyanide, making it a safer and more efficient choice for maintaining optimal health. Most importantly, you're still here with us and may have overlooked subscribing. If you find this video beneficial and recognize the effort being put into it, we would appreciate seeing your opinion in the comments. Don't forget to subscribe to our channel and feel free to return to continue engaging with us. 3. Vitamin E, natural sources over synthetic. Vitamin E is renowned for its powerful antioxidant properties, which protect cells from oxidative damage caused by free radicals. This protection is crucial in maintaining the integrity and function of various tissues and organs, thereby supporting overall health. However, not all forms of vitamin E are created equal, and the distinction between natural and synthetic sources is important for maximizing benefits while minimizing risks. Synthetic vitamin E, often labeled as alpha-tocopherol, is commonly used in supplements and fortified foods due to its cost-effectiveness and stability. Despite its widespread use, synthetic vitamin E has been linked to several health risks. Studies have shown that high doses of synthetic alpha-tocopherol can increase the risk of high blood pressure, stroke, certain types of cancer, and kidney damage. These adverse effects are thought to arise from the body's difficulty in metabolizing and excreting synthetic forms of the vitamin, leading to potential toxicity. In contrast, natural vitamin E, which includes a mix of tocopherols and tocotrienols, is found in a variety of foods and is better utilized by the body. Natural sources of vitamin E not only provide the alpha-tocopherol form but also other isomers like beta, gamma, and delta tocopherol, each contributing uniquely to the antioxidant defense system. This diversity enhances the overall efficacy of vitamin E in protecting cells and supporting health. Foods rich in natural vitamin E offer a safer and more effective way to meet daily requirements. For example, sunflower seeds are an excellent source, providing about 35 milligrams of vitamin E per 100 grams, which is well above the recommended daily intake of 15 milligrams for adults. Almonds are another potent source, offering approximately 25.6 milligrams per 100 grams. Leafy greens such as spinach also contribute valuable amounts, with around 2 milligrams per 100 grams. Incorporating these foods into your diet not only ensures adequate vitamin E intake but also delivers a host of other beneficial nutrients. Sunflower seeds, for instance, are rich in healthy fats, protein, and minerals like magnesium and selenium. Almonds provide additional fiber, healthy fats, and essential vitamins like riboflavin and niacin. Spinach is a powerhouse of vitamins and minerals, including vitamin K, vitamin A, folate, and iron. To summarize, while synthetic vitamin E supplements can pose significant health risks, natural sources of vitamin E offer a safer and more holistic approach to achieving adequate intake. By focusing on a diet rich in vitamin E-containing foods such as sunflower seeds, almonds, and spinach, individuals can harness the full antioxidant potential of this essential nutrient without the associated dangers of synthetic forms. 2. Vitamin A, avoiding toxicity. Vitamin A plays a crucial role in maintaining healthy vision, supporting immune function, and facilitating proper reproductive health. It is an essential nutrient, meaning that the body cannot produce it, and it must be obtained from the diet. However, as a fat-soluble vitamin, vitamin A can accumulate in the body's tissues, particularly in the liver, and excessive intake can lead to toxicity. This risk is significantly heightened in individuals with impaired kidney function, as their ability to excrete excess vitamin A is compromised. Vitamin A toxicity, also known as hypervitaminosis A, can manifest in various symptoms, including nausea, headache, dizziness, blurred vision, and even more severe conditions such as liver damage and increased intracranial pressure. Chronic toxicity can lead to bone thinning, joint pain, and birth defects if excessive intake occurs during pregnancy. The tolerable upper intake level, UL, for adults is set at 3,000 micrograms mcg of retinol activity equivalents, RAE, per day, which underscores the narrow margin between adequate intake and potential toxicity. People with kidney disease are particularly vulnerable to vitamin A toxicity because their kidneys are less efficient at filtering and excreting the vitamin. Therefore, it is critical for these individuals to avoid multivitamins containing preformed vitamin A, retinol or retinol ester, and to be cautious with foods that are exceptionally high in vitamin A. For example, fish liver, such as cod liver oil, is incredibly rich in vitamin A, with a single tablespoon providing up to 4,080 micrograms RAE, far exceeding the recommended daily allowance. To ensure safe and adequate intake, individuals, especially those with chronic kidney conditions, should consult healthcare professionals to determine their specific needs. Healthcare providers can assess dietary habits, review potential supplement use, and recommend appropriate sources and amounts of vitamin A. For many, obtaining vitamin A from beta-carotene, a precursor found in colorful fruits and vegetables like carrots, sweet potatoes, and spinach, is a safer alternative. Beta-carotene is converted to vitamin A in the body on an as-needed basis, reducing the risk of toxicity. In summary, while vitamin A is indispensable for various bodily functions, it is imperative to approach supplementation and dietary intake with caution to avoid toxicity. People with impaired kidney function must be particularly vigilant, avoiding high-dose supplements in foods rich in preformed vitamin A. Regular consultation with healthcare professionals can help manage and tailor vitamin A intake to individual health needs, ensuring benefits without the risks of excess. 1. Vitamin C, preventing kidney stones. Vitamin C, also known as ascorbic acid, is a vital nutrient involved in numerous physiological functions. It plays a key role in the growth, development, and repair of body tissues, supports the immune system, aids in the absorption of iron from plant-based foods, and acts as a powerful antioxidant, protecting cells from damage by free radicals. Despite its many benefits, excessive intake of vitamin C can pose health risks, particularly concerning kidney health. One of the primary concerns with high doses of vitamin C is its conversion to oxalate, a substance that can form crystals in the urinary tract. These oxalate crystals can combine with calcium to form kidney stones, a painful and potentially serious condition. Research indicates that individuals consuming high amounts of vitamin C are at an increased risk of developing kidney stones, particularly if they already have compromised kidney function. In such cases, the kidney's ability to filter and excrete oxalate efficiently is impaired, leading to higher concentrations and an elevated risk of stone formation. The recommended dietary allowance, RDA, for vitamin C varies by age and sex, but for most adults, it is set at 90 mg per day for men and 75 mg per day for women. The tolerable upper intake level, UL, for adults is 2,000 mg per day, which is the maximum daily intake unlikely to cause adverse health effects in the general population. However, for individuals with a history of kidney stones or existing kidney issues, even lower intakes can be problematic. For those with compromised kidney function, healthcare professionals often recommend limiting vitamin C intake to around 100 milligrams per day. This conservative approach helps reduce the risk of oxalate crystal formation, thereby preventing kidney stones and protecting overall kidney health. Foods naturally high in vitamin C, such as oranges, strawberries, bell peppers, and broccoli, can provide adequate amounts of this nutrient without the need for high-dose supplements. These natural sources are generally safer and come with additional beneficial nutrients and fiber. Monitoring vitamin C intake is particularly important for people with chronic kidney disease, CKD. A study published in the Journal of the American Society of Nephrology found that high vitamin C intake was associated with an increased risk of hyperoxaluria, elevated levels of oxalate in the urine, in patients with CKD. This underscores the importance of dietary management and careful supplementation in this population. In summary, while vitamin C is essential for numerous bodily functions and overall health, it is crucial to manage its intake carefully to avoid potential adverse effects, particularly for individuals with kidney issues. Limiting intake to around 100 milligrams per day can help minimize the risk of oxalate crystal formation and kidney stones, ensuring that the benefits of this important vitamin are realized without compromising kidney health. Regular consultation with healthcare providers can help tailor dietary and supplement strategies to individual health needs, providing a balanced approach to vitamin C consumption. Let's discuss the most dangerous vitamin for kidney health. The vitamin that damaged the kidneys of the 55-year-old woman I mentioned earlier is vitamin C. While it may not be as harmful as alpha-tocopherol or vitamin A, it has been associated with more hospitalizations. This woman was taking various supplements, including calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and vitamin C. However, only one of these led to her hospitalization. A kidney biopsy revealed a significant amount of oxalate crystals, which can only be caused by vitamin C. She was taking 1,000 milligrams of ascorbic acid daily, which was enough to permanently damage her kidneys. Unlike typical kidney stones and oxalate crystals, she could not regain her kidney function. What is most concerning is that a dose of 1,000 milligrams a day is not considered high. Many brands sell vitamin C in this dosage and recommend taking it daily. This amount can severely damage the kidneys of a CKD, chronic kidney disease, patient. Many people believe this vitamin is safe, but it's not. This story serves as a warning. Always make sure you're not taking vitamins in excessive doses. Just because a little bit of something is beneficial doesn't mean more is better. If you take vitamin C supplements, closely monitor your dosage. 100 milligrams a day is usually safe, but 1,000 milligrams a day can be harmful to your kidneys. Be cautious about how much of this vitamin you're consuming. Taking the right dose of vitamins is crucial for most CKD patients. Maybe you've tried some of these vitamins yourself. We'd love to hear about your experiences. Feel free to share your thoughts in the comments below. Your insights are definitely worth reading. Let's keep the conversation going, stay informed, and most importantly, stay healthy together. Thank you for watching, and God bless you all.